Hello, my name is Dante Downing. I'm a nursing student at MCC. I'm going to be showing you how to discontinue an IV and give a push medication. So to start, we're going over to the MAR and ensure that we have a order in which we do. It's give Dilaudid 2 milligrams IVSP every 2 hours as needed for complaint of pain related to coughing. Now that we have our order, I'm going to again check that the order on the computer matches my hard copy order, which it does. Everything is accurate. We have the right patient, drug, dose, time, route, and documentation. Within the label of Dilaudid, it says 2 milligrams per mil and dilute with 2 mils normal saline for IV administration. So after doing the conversions and all the mathematics around that, we are going to be drawing up 1 mil of medication with 2 mils of normal saline to dilute, in which I'll be drawing up a total of 3 mils for the injection. Now that we have again identified the 6 patient rights and we meet everything, we are good to continue. I am going to head on over, get my equipment from the room in which I have my vials, my needle, some alcohol prep pads, some cotton balls, some gauze, gloves, and some pocket hand sanitizer with me. I'm going to wash my hands before I enter the patient's room. Enter the patient's room. Hello, identify myself. My name is Dante Downing. I'll be your nurse for tonight. How are you doing? Good. Are you having any problems with your IV? Any pain, redness, swelling, things like that? No, perfect. Again, I'm just going to assess the site anyway. I'm going to get 2 patient identifiers. Going to get your name or full name and date of birth. Wonderful. So again, I'm going to do my 3rd check and again make sure that we meet the 6 patient rights and we have everything in order. Now that we have done that, we are good to DC the fluid. So I am going to clamp this. I'm going to put on gloves just because. I don't know if it's necessary or not. I'm going to do it anyway. Just because I'm getting near that IV site. So now that I have these on, I have clamped my medication. We are good to DC it, so just remove this right there, easy peasy. Remove it from the IV pole and discard it in the appropriate disposal bin. Now that we have done that, remove my gloves, head over to the bedside computer, wash my hands again, and document that we DC the original IV infusion of 0.9% NS, 1,000 mils to infuse. DD by D Downing, student nurse at 1200. That's it. We are good to continue with the 2nd step of our procedure. We are going to be giving the IV push medication, so I'm going to draw up my medication. Alright, discard these and the sharps, where all sharp things go. Clean off the top of my medication first. Now that that's done, remove this, bevel up. Oop, not just yet, I forgot. Gotta draw back 3 mil, 1 mil of air. Yep, there we go. Alright. Then bevel up, inject, shoot in the 1 mil of air, flip it. Draw back the 1 mil of medication. Perfect. Do the 1-hand scoop technique. And then I just want to get the bubbles out before I move on to get the saline in. Perfect. Clean off the saline top. Perfect. Bevel up. This is when I would perform my second check again, that I have, the right drug dose, and it's for the right patient at the right time, and make sure that it's also the right route. Perfect. Alright, now we're going to return to the patient room after I have drawn up the medication. Return the medication to where I got it from, wash my hands. Enter the patient's room, knock knock, hello, I am your nurse again. Can I get your full name and date of birth? Wonderful. Now before we start, I'm going to flush with 5 mils. Now that we have flushed with 5 mils, I'm good to inject the medication. Before I do that, I'm going to set up my next flush medication. It's lotion. Can you open this? There we go. Thank you, assistant nurse. Now, I'm going to ensure again that we have 3 mils of medication. Have another nurse look. Good. We're good to give it. So, I already flushed with 5 mils, and now we are good to inject our med. And then I'm going to do this over a span of 2 minutes. As the order says, give 1 milligram of Dilaudid over 2 minutes. But for the sake of this, we are just going to slowly give it in a quicker time span than 2 minutes. Perfect. Now that that's done, discard these in the sharps container. And flush again with 5 mils of saline. Perfect. Alright, so that's going to help you with your cough, with the pain, and then in regards to the Luer lock, the Luer lock is used as a device to keep blood flow from coming out, but allows us still to give medication going in. And yeah, it's very simple. It's just you won't be getting continuous medication, although we will give you intermittent medication as needed. So now that we've provided education, we have given the medication, ensured that she's having no adverse reactions, things like that, and she's tolerating it well. We're gonna again wash my hands for the 5th time, and head over here to the computer document that we gave Dilaudid 2 milligrams. Documented by Nurse D. Downing, initial DD at 1200 by today's date. Document that. Now that we have documented that, we are good to DC the catheter, the IV. Ensure that we have an order for that, in which we do, again, the 6 rights. We meet the 6 rights, and we are good to continue. Also, before I continue, when I DC the infusion, I also would have flushed 5 mils after I took out the saline, just to make sure that everything was given, there's no residual in there. So now that that's done, we are good to DC the IV cath. So I'm going to don some gloves, introduce myself to the patient. Hello, my name is Nurse Downing again. How are you doing? Good. How is the pain? Wonderful. I am here to DC the IV cath, and we'll get you on your way. So now that we have introduced ourselves, can I get your full name and date of birth? Perfect. We need the identifiers. We're good to continue with our order. So I'm going to come over here, get my alcohol, get my gauze, get some tape, get everything ready. stomach's growling. Alright. And get another thing of gauze, just for the sake of equipment that we do not have as nursing students. I would have placed a bigger gauze pad underneath this, so once I take it out and we have possibly blood coming out, it's not going to get all over the patient, it's not going to get over me, it's just going to get soaked up in a way bigger gauze pad that I do not have. But we're going to place that right there underneath the patient, and then we are going to take off everything except for the cath. Perfect. Discard of all that. Again, this little gauze pad is my way bigger gauze pad. It would be underneath just to catch anything if something was to come out. Now that we have all that hooked up, we are good to take out the catheter. So, I'm going to get this and get some alcohol, clean around the site. Not on it, but just around it. Now that that is done, get this, my alcohol, on my cotton ball, and then pull out with one hand slowly, and then apply pressure to the site of which the catheter was in for about 2 minutes, just to stop the bleeding and get some clotting going. I'm also going to inspect the catheter, make sure it's intact, make sure there's nothing wrong with it. After I have inspected the cath and everything is good, nothing is abnormal, we are good to dispose of this in the appropriate container. Again, hold this for about 2 minutes. Alright, now that we've held it for about 2 minutes, I'm going to discard of all this. Get an appropriate dressing, although which I do not have, so we're going to use another cotton ball. Get a big piece of tape that I also have, and then just tape it over the site. Instruct the patient to leave it on for 20-30 minutes, just to be safe. Leave that on. Clean up my area. Lower the patient again to a comfortable height after I was in a comfortable working height. Ask her if my patient needs anything else. I'll give you your call light. If you need anything, hit your call light. Will be in shortly. I hope you have a good rest of your day. So I'm going to go over here back to my MAR, document that we DC'd the IV infusion. Tolerated it well, no adverse reactions, nothing like that. Now that that is documented at 12:30. Documented today's date, D-downing, my initials. All done.